How will the voice help close the gap?
There's a lot of existing research, both internationally and in Australia, that demonstrates that when Aboriginal and Torres Strait Islander people or Indigenous people are dealing with the consequences of their own decision-making, that the decision-making is more precise and that you get better outcomes as a result. It's believed that the voice will be comprised of people with the right expertise and knowledge to give advice to government and indeed keep government accountable for the way that they are delivering services to First Peoples right across the country, seeking to improve the impact of that service delivery and that policy making.
You spoke movingly at the Yes campaign launch about your own health and about what you hope the voice would do for Indigenous health. Can you expand on that? What will the voice do for Indigenous health and why is this so close to your heart?
Well, I think when we look at the way that the Aboriginal community-controlled health organisations worked well together during COVID, demonstrated that that expertise, that leadership, that direction really did help us avoid what could have been a much greater risk and crisis of COVID outbreaks in Aboriginal and Torres Strait Islander communities. The idea that that expertise and direction could come through a permanent voice that would be able to track progress in that regard and maintain that accountability and dialogue about what is working on the ground, I think has to make a positive difference. Through my own experience, which has most recently resulted in me having to have a right lower leg amputation, has really made me realise how much was lacking in terms of health intervention at the preventative level. And in my case, I feel like if I'd had greater support in those early stages of my diagnosis, I would have been in a much better situation than I find myself in now. And I think that's just one personal story when I know that there's thousands of others out there that similarly would benefit from early intervention.